You're watching Beyond Markets, where we bring you up to speed on development outcomes from across the continent. I'm Kenneth Igbomor, and thank you so much for joining me on the show today. Coming up on the show today, we'll be looking at the global response, a call for global response to tackle the COVID-19 outbreak as the world comes together to fight this common enemy. You can join the conversations by sending your tweets to our handle at CNBC Africa. You can also tweet at me with the hashtag Beyond Markets, and my handle is at Kenneth Igbomor. Now, an international group of 165 people, including 92 former presidents and prime ministers, along with current economic and health leaders in the developed and developing world, have come together to demand the creation of a G20 executive task force and an immediate global pledging conference that would improve and coordinate a multi-billion dollar coronavirus fund. And joining me to discuss this today is Professor Erik Berglof, is the Director of the Institute of Global Affairs and School of Public Policy at the London School of Economics and Political Science. Thank you so much for joining me on the show today, sir. But I'd like to start off with this call that you are making. Can you speak to me on the details and what timelines are we looking at here?
Well, I think we are actually talking about something that needs to be in place very urgently. The situation now in much of the developing and emerging world is very urgent, and we need to, even in the next few days, try to make sure that this response is in place. And there is a meeting of the G20 finance ministers on Wednesday, and there's the spring meetings of the IMF and the World Bank later this week. So it's really very important to grab this opportunity to get some major decisions that can support developing countries.
All right, but I'd like you to speak on the need for that international collaboration between, I'm looking at the names here, that level of collaboration and why we need these strong voices to pass this message across.
Well, I think the problem has been that the big rich countries have been very preoccupied with their challenges of fighting the virus in their countries, both the medical side and the economic side. What we now need to think about is a global response. What needed is a very important coordination of efforts by the advanced economies, the international financial institutions, the World Bank, the IMF, and that is all coming together this week, and that's why this letter was timed for this week. The problem is that no one has been able really to focus on the situation in the developing world. The developing world has been lagging behind because that's the nature of the pandemic, that it started in places that are sort of most connected, and of course for a while China was the epicenter, then came Europe, and now it's the United States that's the epicenter. And what we are very worried about is that this is now also hitting Africa, and of course you have many countries now with quite a few cases, and we want to, well, there's still room to address this challenge. We need to do so, and we need to work with these international institutions that we can that are really the only tools that we have in the current situation.
Looking at the implications here, because first we're starting with a health crisis that has slowly become somewhat of an economic crisis as well, because there's been talks of a possible global recession coming in, and we're looking at lockdowns across different countries. Even in Africa here, we're seeing countries, shut down their economies, and then we're looking at the ripple effect and that is going to have on these economies going on. As an economist, someone who's looking into that space, I'd like to hear your thoughts on the implications for the global economy.
Well, as you said very rightly, these are two different crises. It's the medical crisis and the medical emergency and the economic impact on that. But they're very closely related. So the quicker we can address the medical emergency, the more likely we are to reduce the economic impact. And of course, the economic impact will feed back into the medical emergency. There won't be enough funding for healthcare. There won't be, people will be their jobs and so on. and are more likely also then to become burden for the healthcare system. So addressing these two challenges at the same time and making sure that we get the medical response right, and then do the best we can to also help those that are affected by losing their jobs or in other ways suffering from the medical emergency.
Still on the impact, I understand that you're also calling for a debt interest payments of poorest countries to be waived. You're also asking for a global fiscal coordination that is essential to avoid a recession becoming a depression. I'd like you to speak, especially on the first point, talking about waiving debt interest payments. Today, we've seen the IMF come together to say that they're, announcing debt relief for 25 countries as part of the first batch of countries that are going to be benefiting from that. What do you make of this development?
Well, I think this is very important. It is a very unique situation. This is none of the fault of the countries that have these large debt burdens and debt repayments. We need to sit down around the table, both the official lenders, like the countries that have been lending, the international financial institutions that have been lending, but also the private sector. And I think there are, as you alluded to, some processes ongoing now, particularly led by the IMF, to try to get this sorted out. And for sure, we cannot see these debt repayments now when we're trying to push in resources into these countries to deal with the economic and impact, and then also with the medical emergency. So that's very important to get some kind of standstill or a moratorium on the repayment of debt. And then we have to see if we can use this opportunity also to get rid of some of the debt that's on the books of many countries.
All right, let's see what you're trying to get to and be agreed on within a couple of days. I understand that you're trying to get 8 billion to rapidly hasten the global effort for vaccines and cure the treatment. You're also asking for 35 billion to support health systems, from ventilators to test kits, to ensure that the health workers are, have the protective equipment that they need. And also, you're also calling for 150 billion for developing countries to fight the medical and economic crisis to prevent this. But looking at where you stand right now, what has been that reception so far from the G20 economies so far?
Well, I think that was the starting point of the letter, was that the G20 countries, the shareholders of these international institutions, they were not really hadn't taken in the full impact of the pandemic in the emerging and developing world. And we see now increasing signs that indeed they are becoming more aware of the situation and are trying to, in various ways, contribute. But they're still very much behind what is being happening in the international financial institutions themselves. So in the World Bank, in the IMF, they have been seeing this coming for a long time. And the IMF now has, I think, more than 90 formal applications for emergency assistance. The World Bank is doing a lot on its side. But I think the shareholders need to come in and back up these institutions and bring all these different processes together: the emergency financial liquidity support from the IMF, the program support from the World Bank, and all resettling or restructuring these debts, and all that needs to come back together in sort of one coherent effort. And that's where the G20 leaders are so important.
All right. One interesting fallout we've seen from this is how this has, rippled down to affect the oil and gas markets. We've seen the price war between Saudi Arabia and Russia play out. Luckily, we're hearing that OPEC and its allies have managed to come to a conclusion and agreement to get production cuts of about 9.7 billion barrels per day. But I'd like you to speak to this point and the ripple effect we're seeing this play out on other sectors.
Yes, well, definitely it was important to get some kind of agreement in the oil market. It's unclear whether this will be enough, but that was important. Of course, it's particularly important for those countries that depend on the income from this market, but it is a very important sector of the economy globally. So it's it's important to make sure that it's not in some kind of free fall. But for many emerging and developing countries, it's also the impact this is having on other commodities, so other things than oil. It's also having an impact on tourism. So those revenues are not coming in the same way. A lot of investors are withdrawing exposures that they have in developing countries, so that you get capital flight, and then of course very importantly and particularly for Africa, the remittances of Africans living abroad, that is coming down quite significantly, and that bringing all this together makes for a very difficult economic impact. And in a way, the economic impact has come even before the medical impact, so which is different, of course, from what happened in China or what happened in Europe, where the medical emergency and the epidemic and pandemic, when that hit, it took some time for the economy to respond. In Africa, for example, now, of course, the economic impact is coming with a vengeance, while the medical impact is, in most places, not felt as strongly yet.
Looking at the history of outbreaks we've had in the past, I'm trying to look at the learning curves that we've gotten here as a global community. You know, we've had SARS, we've had MERS, and even more recently, we had the Ebola crisis in in West Africa. You know, but I'm trying to look at the learning curves that have come out from all these outbreaks in the past. And do you see that we're in the right trajectory to formulate a plan to dealing with these pandemics, you know, going forward?
Well, I think the Ebola crisis, which is the most recent one, and I'm talking now about the West African Ebola epidemic, that was not handled perfectly, and it's a lot of difference between countries. Maybe WHO did not perform as well as one would have liked, but there were many lessons from that experience, and I think that hopefully the lessons that we will now make use of when we're trying to fight the COVID-19 epidemic in Africa. I think WHO has picked up and has played an important role. You can always complain about individual things, but on the whole, I think it's an absolute critical institution, and it's going to be very important for the response now in Africa. But it's very important that WHO is not left alone. It needs to have work with the World Bank in particular. Also in the Ebola crisis, actually the IMF played a very important role in bringing liquidity quickly into the countries that were affected, and allow them to be more forceful in their response on the medical side as well. So what this really brings out is the need for the global system to work together and support the economies that are being hit for no fault of theirs, and we need to really be behind these institutions and make sure that they get the resources that are needed to assist the countries.
All right, Erik, I need you to hold that thought for us while we'll just take a quick break, and when we return, definitely we'll continue our conversation on this call to and the need for international collaboration to tackle the COVID-19 pandemic. Thank you so much for your time, Erik. We're back after the short break. Welcome back to Beyond the Market. If you're just joining us, I've been speaking to Professor Erik Berglof. He's the director of the Institute of Global Affairs at the School of Public Policy at the London School of Economics and Political Science. And we've been talking about this, interesting call here by global leaders to get the G20 to do more in tackling the coronavirus pandemic that is affecting the whole world. And Erik, picking up from where we left off, I would like to talk about the importance of seeing a strong collaboration happening at this level to tackle this global pandemic?
Well, I think there is a fair amount of collaboration, a very good collaboration between the different international institutions. There's very good collaboration between the WHO and the World Bank in particular. I think the next step is, of course, to get the G20 to really focus on this collaboration at the global level. We had in the global financial crisis very effective collaboration, and it was very much led by Gordon Brown at the time, and we need to learn lessons from that. And I think what is missing right now is a some kind of task force at the G20 level that can really look at how to pull the whole system together, make sure that all the different parts are doing their share and that they're working in the same spirit and with the same objective. And I think that's, we're not there yet, but I think this is a very important task. And the meeting, there was a meeting held with the G20 leaders about 10 days ago, and that produced a very good document that described the situation, but it was still quite short in terms of actual measures to put in place. And that's what this letter that we wrote was about, to say which are the immediate steps that need to be taken to make sure that we address both the medical side of this and the economic side. And we are convinced that the G20 will come together on this, and there will, as I said, be a meeting with the finance ministers on Wednesday, and that should hopefully move the discussion further along.
All right, but in terms of policy response, so looking at how governments across the world have responded to this, from the United States to across Europe and even in Africa, I'd like to get your assessment of the level of policy response that we're seeing, and if you see, if there are any lapses on anywhere you think an organization like yours as well can come in to assist.
Well, obviously there's already, between the different advanced economies, a lot of differences in how they have approached it. So these differences we'll have to see later on which were most successful. But I think the crisis now is moving into the developing and emerging world, we have to think differently, because many of the measures that were undertaken in countries like France or Germany or the UK or now in the US, many of those measures are not really feasible. It's very hard in many countries in Africa to have meaningful social distancing when you're living in such close quarters. You may not even have access to clean water, and to follow all these advices and rules, regulation, locking down the economy is very difficult. Or locking down cities, in the type of economies that Africa has. So we need to think differently, and we need also to think, how we can act as quickly as possible, and how we can make sure that we use existing systems for transferring money into those most vulnerable. And here, for example, the World Bank has these kind of cash transfer programs in many countries, and I think more than 80 countries. And those are networks that we can use now to make sure that we get resources out to individuals who are suffering and who are being affected both on the medical side and by the economic result. My sense is that when we look back at this crisis, that for sure we were not compared at all at the national level, and also when we look at how the international institutions managed to react, we also probably will learn lessons. And it's important now, though, that we focus on addressing the problem. We cannot waste a lot of time on recriminations and trying to find out who did wrong at one particular point in time. And so we really need to focus on what needs to be done from now on. There will be a time for looking at the lessons from this crisis.
All right, it's interesting that you mentioned, focusing on the problem, but then I would also like to look at the role of different actors when you talk about the state from governments to multilateral development institutions, development finance institutions. But the key part I would like to also look is what is your assessment of how the private sector, has come out in dealing, with the challenge here?
Well, I think the private sector definitely has a very important role to fill, and we have seen responses from individual companies trying to convert production, from maybe cars or airplanes and producing ventilators for companies converting alcohol production to disinfectant and so on. All those are very good individual responses. I think what's still missing is a kind of a combined, coordinated response from business, and also from business coming out and supporting the efforts of the international financial institutions. And we're going to need them to work with these institutions, with the World Bank, with the regional development banks, like the African Development Bank and so on. That is going to be a very important role, particularly as we try to get the economy back on track once the pandemic is not as powerful in its force. And of course, what we need to worry about also then is how we can avoid getting second and third waves of the same virus. And that, again, the private sector has a huge role, of course, in helping out to find vaccines, finding better treatments against the virus, finding maybe better ways of organizing healthcare. I think in all those dimensions, the private sector play a very important role. But we were talking earlier about the role also now for private creditors to realize that this is a situation that goes far beyond the control of any individual country, and we need to have an understanding for that when we look at debt repayments and so on. So there's many different dimensions to the private sector's engagement and need to play part in this current crisis.
Also, Erik, talking about getting the health system back on track, we can't but notice the shortages that we see across the value chain in the health system, especially in Africa. Shortages from manpower to skills to expertise to even materials on ground to help to solve some of these challenges. What sort of response would you like to see in this regard?
Well, I think first of all, it's very sad, and it of course is a statement on how much this sort of brain drain in much of Africa of nurses, of doctors and so on, people that would really be needed now who are working in other parts of the world. And I think there's no simple answer to this. We need, of course, to mobilize everyone we can. We need to has been happening in many advanced economy, taking people out of retirement, maybe moving people who are working in the military, for example, into the regular healthcare and so on. But we have to understand that the resources for doing that is very limited in many countries. So yes, this is going to be a very serious challenge, and everyone who can contribute has to help out. And again, we mentioned the private sector. I think the private sector can play an important role here, maybe also releasing some staff, because they have not, many of them have lost a lot of demand for their products and for their services, and maybe these people can be used in one way or another to help make sure that the medical system works better. Also, probably we're going to have problems with work in the agricultural sector. So maybe there are some people who, for now, for reasons of this economic impact of the crisis, cannot work in manufacturing or other parts of the economy. Maybe they can help out, make sure that there's enough workforce in agriculture. It depends, from country to country what type of agriculture we're talking about. But certainly for some countries, we're relying on guest workers and so on. That's an important challenge, to get enough people to make sure that the harvest is sufficient.
All right, then. Thank you so much for your contributions on the show today. Definitely a lot of insights there to look into, and as we come together to look at how the world is tackling this COVID-19 pandemic. I've been speaking to Professor Erik Berglof. He's the director of the Institute of Global Affairs at the School of Public Policy at the London School of Economics and Political Science. And that's it on Beyond Markets for today. And thank you so much for being a part of the show today. As always, you can watch this show at 5 p.m. West African time daily and have access to all episodes of Beyond Markets on our website. That's at CNBCAfrica.com. You can also stay engaged with the hashtag Beyond Markets. Send me a message. Let me know what you think about the topics that we discussed. I'm Kenneth Igbomor, and thank you so much for watching.